Hi, I am Tomas Guevara, and this is the channel Rewriting the Reality. Have you ever suffered chronic pain? Subscribe to this channel and hear the story about OxyContin, the painkiller responsible for thousands of deaths by overdoses. We recommend watching these two TV series, Dopesick in Star Plus and Netflix's Painkiller. Both series effectively explore the real-life opioid epidemic in America, although Painkiller has received more polarizing reviews compared to Dopesick. Dopesick takes a more factual approach to the opioid crisis, while Painkiller focuses more on dramatizing true stories and includes intentional factual deviations. Both shows shed light on the need for better regulation of medicines and the role of pharmaceutical companies like Purdue Pharma in the opioid crisis, with the Sackler family and OxyContin facing scrutiny in both series. The OxyContin story, origins, controversies, and impact. OxyContin, a prescription painkiller, has been at the center of a compelling and controversial narrative that spans several decades. This report delves into the story behind OxyContin, exploring its origins, the controversies it has faced, and its profound impact on public health, society, and policy. OxyContin, the brand name for the opioid painkiller oxycodone, was introduced to the market by Purdue Pharma in 1996. Marketed as a breakthrough in pain management, OxyContin was specifically designed to provide extended relief over 12 hours due to its time-release formulation. Purdue Pharma promoted the drug as less addictive and prone to abuse compared to other opioids, positioning it as a solution for chronic pain sufferers. The rapid rise of OxyContin's popularity was accompanied by several controversies that would later shape its story. First, Purdue Pharma's aggressive marketing tactics downplayed the risks of addiction and overemphasized the drug's efficacy. These efforts contributed to an overprescription of OxyContin for various levels of pain, including mild cases. Second, by the early 2000s, reports of OxyContin abuse, addiction, and overdose began to surface. It became apparent that the drug's time-release mechanism could be easily circumvented, leading to rapid and intense heights. Third, OxyContin's role in triggering an opioid addiction epidemic in the United States became increasingly evident. Users who had been prescribed the drug for legitimate medical reasons were becoming addicted, and many turned to illicit sources to sustain their addiction when prescriptions were no longer available. Fourth, Purdue Pharma faced numerous legal actions, including lawsuits from states, individuals, and the federal government. These lawsuits alleged that the company engaged in deceptive marketing practices that contributed to the opioid crisis. In 2020, Purdue Pharma filed for bankruptcy and faced significant financial penalties. The OxyContin story has had far-reaching impacts on multiple fronts. 1. OxyContin's widespread misuse and addiction led to a devastating public health crisis, with opioid overdose deaths skyrocketing. The crisis also led to a renewed focus on addiction treatment, harm reduction strategies, and opioid prescription guidelines. 2. The opioid crisis prompted governments to implement stricter regulations around opioid prescriptions and monitor prescription practices more closely. Many states also introduced prescription drug monitoring programs to track prescriptions and identify potential cases of abuse. 3. The OxyContin saga highlighted the importance of raising awareness about the dangers of opioid misuse and addiction. Educational campaigns sought to inform the public, healthcare professionals, and patients about the risks associated with opioids. 4. Despite efforts to curb the opioid crisis, challenges remain. Many individuals who became addicted to prescription opioids transitioned to illicit opioids like heroin and fentanyl. The crisis also exposed gaps in addiction treatment availability and societal attitudes toward addiction. Conclusion: the story of OxyContin is a cautionary tale about the complex interplay of pharmaceutical marketing, prescription practices, addiction, and public health. The drug's origins as a purported breakthrough in pain management were marred by controversies stemming from misleading marketing and the ensuing opioid epidemic. The impact of the OxyContin story continues to be felt through policy changes, addiction treatment efforts, and ongoing struggles to address the consequences of the opioid crisis. Purdue Pharma, the company responsible for manufacturing and marketing OxyContin, faced numerous lawsuits and legal actions related to its role in the opioid crisis. In September 2019, Purdue Pharma filed for Chapter 11 bankruptcy as part of a settlement agreement reached with various states, local governments, and other plaintiffs. The bankruptcy filing was intended to facilitate the creation of a public benefit company aimed at addressing the opioid crisis and providing resources for addiction treatment and prevention. Under the proposed settlement terms, Purdue Pharma and the Sackler family, owners of the company, agreed to pay $6 billion to address the opioid crisis. The Sackler family faced allegations that they profited from the opioid epidemic through their ownership of Purdue Pharma. The settlement funds were intended to provide financial resources to affected communities, support addiction treatment programs, and establish a national opioid abatement trust to manage and allocate the funds. The proposed settlement faced significant challenges and controversies. Some state attorneys general and other plaintiffs argued that the settlement did not hold the Sackler family sufficiently accountable for their role in the opioid crisis. There were concerns that the settlement might shield the Sacklers from further liability. In November 2020, Purdue Pharma's bankruptcy plan received approval from a federal bankruptcy judge. The approval allowed the company to move forward with the establishment of a public benefit company and the distribution of settlement funds to address the opioid crisis. Now let's talk about pain. Pain is a reality, a hard and awful reality. In some videos we have talked about the placebo effect. Pharma companies must carry out studies about any new drugs before being approved. Clinical trials for new pharmaceutical drugs often involve the use of placebos, especially in randomized controlled trials. Placebos are inactive substances, like sugar pills or saline solution, that are designed to resemble the active drug being tested. Placebos are used as a comparison or control group in clinical trials to help researchers assess the true effects of the experimental drug. The use of placebos serves several important purposes in clinical trials. 1. By comparing the effects of the experimental drug to those of a placebo, researchers can determine whether the drug has a specific therapeutic effect beyond what would occur naturally or due to patient expectations. 2. Including a placebo group helps minimize bias and ensures that any observed effects of the experimental drug are not influenced by the patient's or researchers' expectations. 3. In randomized controlled trials, participants are randomly assigned to either the experimental drug group or the placebo group. This randomization helps ensure that the groups are similar at the start of the trial, reducing the potential for confounding factors to affect the results. 4. In some cases, it may be ethically necessary to include a placebo group. For example, when testing a new drug for a serious condition where no effective treatment exists, providing patients with a placebo might be the only ethical way to determine the drug's true effectiveness. 5. Placebos can help researchers evaluate the safety profile of the experimental drug by comparing adverse events in the drug group to those in the placebo group. It's important to note that not all clinical trials use placebos. In some cases, especially when studying conditions where existing effective treatments are available, trials might compare the new drug to the standard treatment rather than using a placebo. The decision to use a placebo or a standard treatment depends on factors such as the research question, ethical considerations, and the specific goals of the trial. In the United States, the approval of new pharmaceutical drugs is overseen by the Food and Drug Administration, FDA, which is a federal agency under the Department of Health and Human Services. The FDA's Center for Drug Evaluation and Research, CDR, is responsible for evaluating the safety, efficacy, and quality of new drugs before they can be marketed and sold to the public. After successful completion of Phase 3 trials, a pharmaceutical company can submit a new drug application, NDA, to the FDA. The NDA contains comprehensive data on the drug's chemistry, manufacturing, clinical trials, labeling, and proposed use. The FDA reviews the NDA to assess whether the drug's benefits outweigh its risks and if it meets the necessary standards for approval. This review process includes evaluating the clinical trial data, safety profile, manufacturing processes, labeling, and proposed use. In some cases, the FDA convenes an advisory committee of external experts to provide independent recommendations and advice on the drug's approval. That was done with OxyContin. While the FDA isn't required to follow the committee's recommendations, it often takes them into consideration. Based on the review and recommendations, the FDA decides regarding drug approval. If approved, the drug can be marketed and sold for the specific indications outlined in the approval. In this case, the approval was done by only one individual, that later was hired by Purdue Pharma. Even after approval, the FDA continues to monitor the drug's safety and efficacy through post-marketing surveillance. If new safety concerns arise, the FDA can take regulatory actions, including label changes, warnings, or even withdrawing the drug from the market. In this case, they only changed the label, asserting that it is believed that OxyContin was not additive. The Supreme Court on August 10 blocked Purdue Pharma from going forward with bankruptcy proceedings, which the Biden administration has called an unprecedented arrangement that would ultimately offer the Sackler family broad protection from opioid-related civil claims. In agreeing to pause the settlement, the court also said it would take up the case and hear arguments this December 2023. The case arose after the reorganization and bankruptcy of OxyContin manufacturer Purdue Pharma, stemming from litigation arising from claims over its role in fueling the opioid addiction crisis. Until recently, Purdue was controlled by the Sackler family, who withdrew billions of dollars from the company before it filed for bankruptcy. The family has now agreed to contribute up to $6 billion to Purdue's reorganization fund on the condition that the Sacklers receive a release from civil liability. We are confident in the legality of our nearly universally supported plan of reorganization, and optimistic that the Supreme Court will agree, Purdue Pharma said in a statement. Even so, we are disappointed that the U.S. trustee, despite having no concrete interest in the outcome of this process, has been able to single-handedly delay billions of dollars in value that should be put to use for victim compensation, opioid crisis abatement for communities across the country, and overdose rescue medicines, the company said. The government, representing the U.S. trustee, has called the plan exceptional and unprecedented in court papers, noting that lower courts have divided on when parties can be released from liability for actions that caused societal harm. The plan's release absolutely, unconditionally, irrevocably, fully, finally, forever, and permanently releases the Sacklers from every conceivable type of opioid-related civil claim, even claims based on fraud and other forms of willful misconduct that could not be discharged if the Sacklers filed for bankruptcy in their individual capacities, Solicitor General Elizabeth Prelogar argued in court papers. Prelogar said that the release of the Sacklers is not authorized by the Bankruptcy Code and constitutes an abuse of the bankruptcy system. The settlement between the Sacklers and 8 states, as well as the District of Columbia, was initially agreed upon in March. Among those states is Ohio, whose Attorney General said Thursday that he was disappointed that the justices paused the settlement and agreed to hear the case. "We wanted the settlement to move forward," Attorney General Dave Yost told CNN's Jake Tapper on the lead. It's so important to get this money flowing. It's been, since 2019, that this bankruptcy proceeding has been going on. I guess the best thing I can say about today's decision to hear the case is at least they set it for December. Gregory Gah, a lawyer for Purdue Pharma, told the justices that a stay application was unnecessary. He noted that the government planned to ask the Supreme Court to take up the case on its own by August 28 and that there is zero risk that the plan could be substantially consummated before this court acts on the request for the justices to take the case. That is all the court needs to know to deny the trustee's stay application, Gah said. He said, for example, that the plan must be updated and reapproved by the bankruptcy court to reflect the most recent settlement terms. After a New York appeals court approved the settlement, Purdue released a statement calling it a victory for Purdue's creditors, including all 50 states, local governments, and victims who overwhelmingly support the plan of reorganization. Our creditors understand the plan is the best option to provide assistance to those who need it most, the most fair and expeditious way to resolve the litigation, and the only way to deliver billions of dollars in value specifically to fund opioid crisis abatement efforts, Steve Miller, the chairman of Purdue Pharma's board of directors, said. Something that the science community is not considering is that pain is a signal from the consciousness of the body, and if you ignore the signal, your body will suffer. The energy retained will create a disease or an addiction. Let me give you a few examples. If you stub your toe, if you gash your leg, if you smash your finger, if you give yourself a concussion, although the concussion is somewhat iffy, but if you have an outside reason for something, if you can see what has caused the discomfort, if you can see what caused the pain, you have a reason. And in that, once you have a reason, you stop paying attention to it and the pain evaporates. The problem is when you don't know what the reason is, you keep paying attention to it. And even if you're not trying to figure it out, you're paying attention to what hurts. You're paying attention to the manifestation. You're not paying attention to what you are doing. You saw what you were doing if you stubbed your foot. You see what you did if you smash your finger. You don't know what you're doing if you have a pain, and you can't see what that pain has been caused by. Therefore, you don't know what to pay attention to. Regardless of how many times I have to say it, it's what you're doing in this moment. You don't pay attention to that, you pay attention to what the manifestation is. Therefore, in that, you continue to pay attention to what you feel, and in that, once again, it affects your behavior. If you are in pain, you will become irritable and continue in pain. And if you take a pill or medicine, momentarily you calm the pain, but you are not paying attention to the cause of the pain. Instead, you think that the body is responsible for causing the pain. You are not doing anything, it is the body, and this is not true. Remember, our body doesn't have a mind, you are the one that is directing your body. Please don't forget to subscribe to this channel to be aware of how we create a more efficient reality. In our next episode, one will give you an exercise in clarity, so you can live better and avoid pain.